Our company is a research company that's called Pregnóstica. Pregnóstica the objective of Pregnóstica is saving time and making early diagnosis during pregnancy. I'm going to present to me. I'm a dentist. I'm specialized in periodontics. These are gums. And I'm a master in dental science. I'm also associate professor and researcher of this university, University of Los Andes. And my research line is focused on the oral biomarkers and their connection with another systemic disease for screening using oral fluids. Our company is an innovative in diagnostic and personalized medicine. The aim or its focus on screening, diagnosis, treatment and follow-up of the pregnant patient. And we are focused on discovering new biomarkers that could be used as early markers of disease such as preeclampsia or gestational diabetes. The main idea of our project, of our company, is moving earlier the diagnosis of preeclampsia and gestational diabetes. What is the main problem? The main problem is that preeclampsia, it's a serious disease, and when it's diagnosed, it's too late for treat. The only treatment for preeclampsia is the premature birth of the baby, and it's still a serious condition. It's a mortal condition for the mother and has many complications for the newborn. It represents high cost for the public and private health systems, and we are trying to moving early the diagnosis. Actually, the diagnosis is between 28 and 33 weeks of gestation, and we are trying to move the diagnosis early in pregnancy, about 11 or 14 weeks of pregnancy. Our proposed solution is a new biomarker-based test detecting placental proteins and microvesicles in oral fluids. Oral fluids are two kinds of oral fluids, are saliva and gingival crevicular fluid. We can take this fluid with a paper point. It's very simple and quickly, about 20 seconds, and we can detect, we hope that we can detect in a very minimal invasive, with a point of care system quickly in the clinic of the doctor. We can have the result immediately. It's, as I say, it's innovative, it's non-invasive, and we can allow the early detection of the placental biomarker in oral fluids. We have a highly predictive ROC curve, and I'm going to show you after. And our main objective is obviously reduce death of the mother and complication of the premature birth. How is the technology? It's a paper point, a paper strip that we can put in the gingival sulcus, and we can combine the presence of one or maybe two placental biomarkers with a clinical parameter of the mother for improving our sensitivity and specificity of predictive capacity. Is easy, sensitive specificity quickly, and our end user obviously are pregnant mother, but also are the public and private health systems in worldwide. Our competitors. How we know about our competitors? Mainly competitors are two, Alere and Alexis. Both companies working with a placental biomarker, but they working in blood sample or maybe in urine sample, and he can detect preeclampsia barely 14 days before to get the disease, and Alexis can detect preeclampsia about 34 weeks of pregnancy. We are talking about Pregnóstica. Our technology can detect with a rock cube about 92% in 11 or 14 weeks of gestation. This is using gingival clavicular fluid that we can preliminary results that concentrate the molecule 8 times higher than in blood or urine samples. The conventional approach is proteinuria and blood pressure, and they are currently not predictive because they can detect preeclampsia within 24 hours. You will be enferma, sick. Our market is huge. We are focused on about 164 million of pregnant per year, and of this size, 3 million are premature births due to preeclampsia. If we have an example for a market size in another country, I like to have my company in India because they have a lot of births per year, and if you consider a cost of our kit between $20 or $30 per kit, we have a very huge market in India with $500 million, and in South America, more conservative approach is Brazil. Brazil has maybe 3 million of births per year, and we have $50 million in our market. In our country, we have about a market estimate about $5 million per year. Our business model contemplates to be a research company that it's focused on research and find new biomarkers and validate with clinical trials our biomarker, and our customer maybe it's a company that will develop a diagnostic kit, and our partner it's going to sell and distribution the kit. How about our corporate plan? We started this project in 2044 with a Corfo fund, and we link the disease preeclampsia with periodontal disease, and we found a significant increase of severe biomarker in women who will develop preeclampsia. Then we realized a cohort trial with 256 women, and we performed all the statistic analysis, and we have the predictive potential of 92% for diagnosis early in pregnancy preeclampsia. We estimate that here to 2021 we now are raised funds. In fact, we applied to a governmental funding, Corfo and Fondef, and also we're talking when a found investor. We have contemplated we need $2.5 million from here to 2021 and we hope go to the market at the end of 2021. Our advantage: we can make an early diagnosis. between 11 and 40 gestation week. This early diagnosis offering a window of time for interventions. We have a paper strip diagnostic. It's very inexpensive way to measure the placental biomarker, and we have two provisional patents, one in USA and one in Europe, one for preeclampsia and another for gestational diabetics. We have a strategic partner. We have a wonderful translational research team composed by gynecologists, a dentist, biochemical, nurse, midwife. We are perform our next clinical trial in the Clínica Dávila, and they have more than 7,000 of deliveries per year. And we are talking with an expert company from Finland in the development of kid diagnostic using oral fluids. And also we have an expert advisor, Gregory Rice from Queensland, Australia, Marta Mancilla from here, Chile, and Richard Garnett, my mentor. Thanks for all.